Right,
Thank you so much.
So I'm going to share my screen. Actually, go back to here. All right, can you all see my screen okay?
Yes.
Yes, everything is okay.
All right, so thank you for having me. So if you have not followed me on LinkedIn or Instagram, I have my LinkedIn and my Instagram on the corner of the slide, and I will have another one in just a minute toward the end. So thank you, first of all, thank you for having me. And I just a little bit about myself. So I actually have not gone to Indiana University, but I spent a lot of time at University of North Carolina, Chapel Hill on the top there, and I was spent almost 7 years in Richmond, Virginia Commonwealth University, and I spent a year and a half in Charleston, and the past year I was spending a whole year at High Point University. So just a little bit about my background. So I went to dental school in Thailand. I grew up in Thailand. I spent 20 years from graduate prosthodontic residency, PhD education, postdoc, and I taught at University of North Carolina, Chapel Hill for 11 years. So now I'm actually a retired faculty from UNC. I'm a diplomate of the American Board of Prosthodontics, and a fellow of American College of Prosthodontists. I work at VCU, which is Virginia Commonwealth University, as director of digital dentistry technology and also director of research. So I actually built the digital center at VCU. I was at Medical University of South Carolina in Charleston for about a year and a half as the Dean of Innovation and the chair of the Department of Reconstructive and Rehabilitation Science. And the past year, I was a professor, associate dean for innovation, and chief innovation officer at High Point University School of Dental Medicine. And I put the two pictures here at John Stam, who's a longtime dean at UNC, and Steve Offenbarkers. Unfortunately, both of my mentors here have passed away, and they have a lot of things that they have taught me, including a lot of soft skill in dental education. So let's introduce a little bit about soft skill in dental education this morning or this afternoon. Some research on the topic, what should or do we teach our students, and give some example of technology that might enhance soft skill. And I'll give you a little bit of summary. What about the literature on soft skill? So there's a recent systematic review in BC medical education, and the author go into the issue in soft skill. And they actually, we are actually past the time of soft skill that nice to have. It needs to be an integral component of human dentistry. And the study have mapped out how to define the soft skill framework tailored to dentistry, and how to train educator to teach and assess as a skill effectively, and how to embed the soft skill into clinical courses, not just siloing, but kind of integrated into the real patient interaction. And the paper also talk about collaborating with patient community to ensure that relevance. And it concluded that dental education must evolve from producing technological capable clinician to develop compassion by developing compassion, thoughtful professional. And you can see that the paper includes over 1,444 records, and they put 317 articles, and it grouped by 4 domains, including dentist-patient relationship, cooperation, teamwork, life skill, personal resilience, and clinical reasoning. And you will find that majority of this initiative focus on the patient-dentist communication, teamwork, and less attention given to emotional regulation, reflective thinking, ethics, or resilience. And there's a gap on standard definition and framework of soft skill, and also lack of long-term evaluation and impact on students or on patients. And there are also challenges in training educators, standardized curricula, and assess methodology. So how are we teaching our dental student right now? So in my opinion, in the last 4 dental school that I have gone to in dental education, perhaps more than any field, we tend to focus, or I would say overemphasize on hard skill, meaning that we focus on procedure, material, technique, clinical competency, and we are more focused on specific teachable skill. And for me, for example, we teach a lot of intraoral scanning, CAD/CAM, how to prep, how to mill a crown, without focusing too much on less emphasis on soft skill, which is over communication, empathy, teamwork, adaptability. And these technical ability remain hollow or not teaching at all in certain dental school. We also need to look at interpersonal skill, emotional skill, and cognitive ability, how we listen to patient better, how to help patient with fear, conflict resolution with our team, or critical thinking. So why are soft skills important? It creates the trust with the patient, depending on how well we communicate with the patient, not just how well we treat the patient. It must be, dentistry is not a one-person skill, right? It's a team-based care. So it demands collaboration, conflict management, and mutual respect. And also, dentistry is evolving, so it has to adapt to change in terms of new technology, regulatory changes. So the practitioner needs to be more flexible and resilient. And the last part that probably most important is our patient care. Professionalism, ethic, and empathy must guide the decision making in a complex uncertainty. So how do we teach these skills to our students? Number one, we can integrate the soft skill into our clinical training. And for example, after procedure, after either clinical or lab procedure, debrief is not only something that went well technically, or how the patient feel, how communicate the challenges and the team dynamics. The second thing is the simulated patient encounter with feedback, meaning that we can do role play, standardized patient, video recorded consultation, and all of these will guide the reflection. And the third one would be interpersonal education. So we can pair the dental student with peer like dental hygienist or medicine dentist, medicine student, nursing, or public health to develop communication and team instinct. And one of the things that I emphasize a lot for my student is reflective writing and journaling. So because this is the part that we don't do very well in dentistry, we must prompt a student to reflect on ethical dilemmas, emotional encounters, patient interaction, and self-awareness. And these are very important to help them develop soft skills. The last one that I'm going to talk about is mentorship and modeling. So faculty must model soft skill openly. The student learn what professional look like, not just from lecture, but from live example. So let's talk a little bit about communication and empathy. The communication skill are probably one of the most important part of dental skill development, which means that the student must learn how to explain things clearly, systematically, have open communication with the patient, and have the ability to reduce the treatment anxiety. And the communication come with ability to demonstrate empathy and compassion, meaning that you can comfort the patient, you can ease the patient from dental phobia. And this is not just that we don't work alone, right? So we have to put clinical thinking, not just for individual student, but in terms of teamwork and professionalism. So we put the clinical thinking and problem solving skill to analyze, to design, to innovate as a team. So we work, how do we work effectively within the dental teams, and how we put integrity, value, and standard within the realm of clinical thinking in the teamwork. So, and the other part is adaptability, leadership, and growth, which is the dentists have to be, or dental students have to be trained as a team leader who can be adapt and resilient, be flexible, and can handle different pressures, and can lead by guide the team, motivate the team, inspire the team. And it also be a time management, have a good time management skill, how to plan and how to stay efficient. And something about the soft skill also go over the lifelong learning, meaning that you committed to continuous improvement. So what the I'm going to close my talk using technology because I'm a technology person. So how can we use technology like AI to help with soft skill? I just happened to work with a company called Gain, and it used an AI to scribe the chairside coaching, meaning that this company have, and I'm going to play a little bit video from my friend Tanner Herty, who's a dentist in North Carolina also, and he used this software to transcribe his interaction with patient. And I'm just going to play the video.
Okay, so we're going to use
you
Gain
watch
right
it.
now to automatically make a clinical note. You're going to see how easy it is. I'm going about my normal day, nothing changes, but come along with me and watch this. So today we're going to make sure everything looks good x-ray wise, and we'll get a game plan, okay? And this Blue Cross Blue Shield would be a huge blessing just because it gets to help you and save you a ton of money. All right, so this is all just simple measurements it's not a test, it's just simple things that the lab wants. 1 millimeter overbite, 1 millimeter overjet, missing 29, 30, 31, 32. Good news, when we're done, you're not gonna be missing anything, all right? We just did a clinical exam consult for a patient that needs full mouth implant. Just like that, Gain made perfect clinical notes, plus to help her decision, she'll get a personal treatment plan showing what it looks like to get a full mouth hybrid. We don't do anything different. We just talk to the patient like normal, and we are able to gather so much information that we can then help them and help us better take care of our patients.
So what you just saw, it basically what the software does was you can turn on the app on the phone, and basically the app or the phone gonna transcribe what you talk to the patient into a clinical note. So it gives you a real-time cue of a subtle prompt for more effective case presentation, meaning that it's not just transcribe it, it also critique how you interact with the patient. It have the sentimental analysis, identify patient question and hesitation for the patient. It also can give your team analytic, provide post-visit data for the team who calibration and training. And what it works is we have an audio caption, which is automatic speed recognition or ASR, and with the speaker separation, so you can separate the people, and you can even actually sophisticatedly can recognize who talking and different person, and then it transform raw conversation into clinical structure, like if you do the self note using large language models, and it analyze facing and tone to flag empathy, clarity, and open question, which is important for soft skill. And for the real-time cue during the visit, post-visit coaching note and patient-friendly draft will be provided for the dental student and provider. And it also have a safeguard of it makes sure that you have consent, you have signage, you have PHI minimization, encryption, and human-in-the-loop review and audit trail, meaning that you could use these if you want to take out all the patient information and use the information for training. So I'm going to close by summarize what we talk about is the power of soft skill in dental education is beyond technical skill. Success in dentistry depends not only on clinical expertise, but also in interpersonal and professional quality. And the core competency are communication, empathy, teamwork, professionalism, critical thinking, adaptability, leadership, time management, and lifelong learning. And this would impact on patient, builds trust, reduce anxiety, enhance satisfaction, strengthen patient-dentist relationship. On the practice, it improves teamwork, foster a positive work environment, and support ethical and effective care delivery. On career, it differentiates professional, drive leadership potential, support continuous growth in a rapid evolving dentistry field. So my take-home message is soft skill is not extra. They are essential skill that empower dentists to deliver compassionate care, achieve clinical excellence, and thrive in their career. And we have to have a balanced outcome, meaning when we teach both how to do and how to be, we must produce not only technical competent dentists, but clinicians who listen, lead, adapt, and heal. Excellent in clinical hard skill must come with excellent in clinical soft skill, because in the end, dentistry is not just about the drill, it's about the relationship. And I put my email address here and I actually summarize these on my LinkedIn that I post today. And if you want to follow me on Instagram. So thank you so much for your attention. I'm going to stop my sharing now.
Thank you so much, Professor Sompop, for your really interesting lecture. It was, I think, the new and brilliant one. If you're agreed, we can go to the next lecturer, Professor Nekoofar, and then after all, we can ask all the participants and read their questions, because now I think we have a question here. But if you agree, we can start our conversation with our participants after all the lectures.
Okay,
Is that
thank
okay?
you. Thank you very much, Professor Sompop, and I enjoyed, and I'm worried actually because some of my slides are exactly similar to yours, but I made some of them. I make it as just a 5 minutes lecture, so I'm going actually by permission from Professor Kowolik and the chairmans to start actually and sharing my screen as well. I hope I can do it quickly. Yes. Can you see mine now?
Yes. Thank you,
Good.
Dr. Nekoofar. The stage is yours.
Thank you. Thank you very much. So I put that for the opening slide. Patients may forget what treatment we perform for them. Many times it happens for me, but they never forget how we made them feel. So let me start by something very simple. When we want actually to inject and produce some local anesthesia for our patient, we can do it in 10 seconds, or we can tell the patient, I can do it for you in a minute or even longer, just to reduce the pain of injection for you. And describe that. When I inject, the liquid goes inside your tissue, expand it, and creates some little pain, like a scratch, but don't worry. And start telling something, maybe even some joke or something, and make it very comfortable for the patient during the injection. Even if I'm an endodontist, so if I did my endodontic treatment, for example, 2 millimeters short of the apex, I cannot sleep at that night. But the patient can sleep at that night if my injection was painless. So that is the idea. That is the idea of the soft skills, how to communicate with your patient. Tell the patient what you want to do. You may say that, okay, I'm quiet. I'm not talking with my patient. I concentrate on the technical parts. And I want to actually go just to the apex or 0.5 millimeter short of the apex, clean the root canal system entirely. And I don't care about the feeling of my patient. Okay, technically it is okay. But emotionally, you need to communicate with your patient. Or emotionally, you should be able to communicate with your patient. So this is interpersonal abilities. We need actually to increase our interpersonal abilities. And the problem is, we believe that, okay, everybody know it. All of our students know how to do that, how to communicate with others. No, it is not the reality. We don't have a lot of people like Mohammed Reza, like Dorsa in our school. Many of our students, they're quiet. If even if we bully them, they are quiet. They don't say anything. That means they don't have enough soft skills. They cannot shout. They cannot say something that they want to tell us because they are afraid about the consequences. So we need actually to know that this is different from finding the apex or finding the orifice of the canal, cleaning the root canal, or whatever in other specialty. Professor Sompop is a prosthodontist. Okay, I'm sure you are worried always about the finishing line. You are worried about a lot of things, clinically, technically. But we need to teach to our students to be worried about a lot of other things as well as the technical part. Obviously, technical part is always there, must be there. But these soft skills are very important, and we are going to use them in our daily life. So in my office, which I'm now inside it, let me show you something. In my office, I have a desk here. When a patient entered to my office, they sit on this chair and talk with them. I don't send them directly to the clinical part. I just talk with them. I start talking. Hello, how are you? What's your name? What are you doing? And sometimes I'm going outside to my waiting room and I invite them myself directly to my room. And then when they see me, they're surprised. Because I know this is very usual probably in European countries for a dentist to go inside the waiting room and invite the patient themselves. But in Iran, it is not very prestigious things that a dentist himself or a professor himself goes out and invite the patient inside the office. Well, it's very always against my prestigious. I should be very posh. I shouldn't talk with my patients long. I shouldn't be open to any criticism from my patient. But no, we need to be very familiar and very friendly with our patient. So I actually categorize the soft skills in communication skills, interpersonal skills, emotional and social intelligence, which is very important. And I like actually to discuss that. So based on your question, I love to discuss about the social intelligence. And I want to ask my first question from my very professor, Professor Michael Kowolik, to talk about social intelligence, because I like Professor Kowolik based on this social intelligence that he taught us. When he came to Iran, he taught us how to communicate and how to increase our level of social intelligence. Obviously, the next important things that I believe makes us free people, makes us good people is critical thinking. Critical thinking is the most important soft skills that we need to improve it in ourselves. We shouldn't accept any literature. We shouldn't accept any opinion. With all due respect to all our professors, to all our teachers, opinion is their opinion. We need to think critically. When they give us a treatment plan, when they ask us to do something, we need to be able to think critically and ask them very polite questions. And the next thing is leadership and management skills that obviously we need to talk about that as well. In dentistry, I would say the first skills or the first soft skills that we need is effective patient communication. That is very important. Sometimes, especially in the first sessions for the student in year 4, year 5, for the first communication with the patient, they start talking, oh, sorry, and patient can understand our anxiety. Patient can understand, can feel our anxiety immediately. But if we want to reduce the patient anxiety, we should show them our empathy. Teamwork with dental staff, obviously very important. Respect the dental nurses, dental hygienists, respect all the staff in the clinic is very important, and it is a part of the professionalism. Ethics as well. And also, we need actually to do very well about the time management. Time management is very, very important. When we arrange or book an appointment for our patient, for example, for 6 p.m., it should be 6 p.m. sharp. It shouldn't be 10 past 6, because that shows that we are not professional. If we are professional, we should respect the time of our patient as well. So obviously, I think Professor Sompop completely talk about this slide, so I don't want actually to go to the details of that. So it improves patient trust. It actually creates a better acceptance rate for the patient, and it creates a better efficiency, and obviously create a better atmosphere for our result and the outcome of our treatment. If we want to do that, because I've seen that many of our professors are in the list of our participants. I can see the name of the Professor Mahdavi, see the Professor Shakuri Nejad, Professor Hashemi, and others. So thank you very much for joining us. So the important things, Professor, is actually to add it up to our curriculum. It is very important. And sometimes we can have this some sort of role-playing and simulated patients for year 1, year 2 students in the curriculum or in extracurricular activities. Puyan, if we can do that, we need to think about that. And one of the things is this interdisciplinary training. Sometimes when I am an endodontist or when I don't care about any others. And it is very important to think about. Mentorship is very important. We need to assign actually mentorship from different professors for our students to talk with them, to create some atmosphere for this good communication. We already have such a things officially. What we need to ask our mentors actually to increase and improve the soft skills of our students. And that's it. So I want to now, because Puyan told me I should make it very quick. Actually, I did it very quick to make sure that I just open the sessions for the questions and for the discussions. Thank you very much, guys.
Thank you so much, Professor. We really enjoyed your lecture. I personally have a question, but I will ask my question after Mohammad Reza's lecture. Thank you again. I want to invite Mohammad Reza, my dear friend, as I previously talked about, a gold medalist of international medical Olympiad, I think. Mohammad Reza, the stage is yours. You can talk about your experience at that national Olympiad. And after that, we can go through our discussion panel. Thank you.
All right. First of all, both of the presentations were very insightful, and this makes my job really hard. I enjoyed them both. Let's begin. Good evening, dear professors and fellow students. It is truly a great honor for me to be here today. My name is Mohammad Reza Yeganeh. I'm an undergrad dental student at Tehran University of Medical Sciences. And in this presentation, I'm delighted to share insights from my experience in the National Scientific Olympiad, where I discovered the crucial role of soft skills. All right. Every year, this national competition brings together students from across the country, all from different medical disciplines. For us, this contest wasn't only a test of knowledge, but also a challenge in how we worked, solved problems, and made decisions together in a highly dynamic environment. As you can see here, this was our great team representing Tehran University of Medical Sciences. At first, I didn't know my teammates very well. We came from different backgrounds and experiences. We were all accomplished as individuals, but the real challenge came in the team stage, where we learned that individual ability alone could not guarantee success. When I think about what truly made a difference in this competition, it wasn't just knowledge. It was the soft skills that shaped how we worked and interacted with each other. Here, I'm going to highlight 3 of them that I personally enhanced the most. I had the chance to be the leader of our team, and one of the first lessons that I learned was that leadership is not about giving orders. It's about creating an environment where open communication can happen. Central to this open communication is active listening. Active listening entails not only hearing your teammates, but truly understanding their concerns. This naturally led to the next step, which was recognizing each team member's capabilities and weaknesses, and this allowed us to delegate tasks effectively. For me, leading the team wasn't only about guiding others, it also became a way to better understand myself, which brings me to my next point. This competition pushed me to reflect on my own strengths and weaknesses and discover interests that I hadn't previously explored. Equally important was realizing how I respond under pressure, since challenging situations often reveal behavioral patterns we might otherwise overlook. These insights set the stage for the next skill. This competition taught me to adopt a growth mindset, which includes viewing challenges as opportunities and valuing the process as much as the final outcome. This perspective not only built my confidence, but also encouraged me to embrace new challenges with openness. In summary, this competition showed me that soft skills are just as essential as academic knowledge. They are what allow us to grow not only as students, but as future professionals. Thank you very much for your attention. I'd be glad to answer any questions that you may have. Thank you.
Thank you so much, Mohammad Reza. It was great. Before anything, I think to begin our panel discussion, I would like to respectfully invite Dr. Michael to share his perspective on the lecture with us.
Okay. Can you hear me? Okay.
Yes,
Thank
have
you.
your voice.
Well, thank you. I'm aware that the time is, when Dr. Puyan invited me, as this is not the first time, of course, and as always, the way my mind works, I scribble down all sorts of thoughts and ideas, and all of the speakers have really touched on very, very important points. By the way, I want to say to Dr. Sompop that I've been in Chulalongkorn many times, and former dean, Dr. Sushit Pulthong, is a friend of mine. And we have a lot of alumni from Indiana who are faculty members in Chulalongkorn, a wonderful, wonderful school, tremendous education. So thank you, all of you. The first thing I thought about, and I try to keep my comments short, and then you can throw things at me if you want, because the first thing I thought of, why on earth do you need this webinar? And the reasons, I think, have been articulated by the speakers. When I was a dental student, we didn't have such webinars, and I have to ask the question, why not? Were we just behind the times, or did we need them? The growth of technology, certainly I've seen it in the United States, but probably everywhere, technology has taken over everywhere. And Dr. Sompop really touched on this. And all these soft skills have been put to the side. So let me give you a quick history here. About 200 years ago, a very clever Frenchman invented the stethoscope, right? Until that time, a medical doctor listened to your heart by putting his ear on your chest, right? Medical doctors were 99.9% men. The patients were 50% women, but he put his ear on your chest to hear your heart, right? Now think about the trust that that requires. Then the stethoscope came along and it made a little distance from the doctor. Then the technology started coming in. Oh, we'll do a blood test. We'll take an X-ray. We'll do it. And now, as Dr. Sompop said, we've got AI, which I, by the way, have another whole series of worries about, but that's not for a conversation now. The point is, we became less humanized as clinicians. And that, I think, is why this seminar is very important and all the things that people have said. I want to say quickly, there's another side to this. When I was still in England and I was running a periodontal department, I got involved, like unfortunately many people have to, in legal cases, litigation. Here you had the soft skills that were 99% of the practice, and the technology was almost zero. And the reason I say that is because there were patients suing dentists who had not recognized periodontal disease. And the universal thing when I got involved as a so-called expert witness was the patient would say to me, oh, but Dr. So-and-so is such a wonderful person. I've trusted him all these years. I've been a patient for 45 years. Why do I have this problem now? Unfortunately, Dr. whoever it was, wonderful person that he or she was, wasn't paying attention to the technology at the time. So, you know, it can go one way or the other. The next question I just want to throw out there is how teachable are the soft skills that are so important? I spent a lot of my time teaching research ethics when I was still working. A lot of time mentoring postgraduate students, a lot of time the last 7 years mentoring faculty for career development. And one of the things that comes up, and the word was mentioned several times, is ethics in this. Now, I have some very close friends who are very senior ethicists, and it was rather shocking to me some years ago when they said, you know, there's a question that goes on and on and on. Can you teach people to be ethical? Can you teach people to be ethical? And there are different points of view on this. But one of the experts I respect said, you know, we have our ethics instilled in us by the time we're age. Guess what? 4 years, 5 years old. And somebody, forgive me, but several people have mentioned very important things here. We have dental students who are technically brilliant. Somebody said they don't, I think it was Dr. Nekoofar who said, you know, but they don't talk, you know? And to what extent can you actually educate people there? Now, there is a program in the United States being used now called KIRA, and I don't know if Dr. Sompop has come across this, to do with assessing dental students' suitability for dental school. As you know, the competition to get into dental school is furious, incredible. And KIRA is a system that has been validated to determine the ethical and teachability of ethical standards with students, not just how brilliant their GPA is and how wonderful their physics was before coming to university, but how much of a humanistic, ingrained humanistic quality these students have, and if not, or if partly there, how much can they be you know, taught going forward with time. So I think there are, you know, a lot of things here that are crucial, and I think I'm definitely the oldest person in this group, and I benefit from that not because of expertise. The word is not expertise, it's experience. And I've seen this time and time again, and all the speakers have touched on this. So I think I'm going to stop talking now because I could say a lot of other things. But I think that, you know, these points are really clear. And the question is, how do you take this forward? I was taught once, when you are, okay, you're a periodontist, a prosthodontist, whatever you are, you know what the skills are. Dr. Nekoofar touched on this. He's an endodontist. He knows all the technology, all the treatment options are available. But the importance when the patient, when he's talking to the patient coming in and good morning, how are you, etc. The question to be asked is, what do you want? What do you want from me as the patient? Here, yeah, I can offer you an implant, I can offer you an extraction, I can offer you heaven on earth in the technology. But what do you want as the patient? What do you want to feel when you walk out of here? And as he quite rightly said in his introductory comment, the patient will remember how you made them feel, not just what wonderful treatment you did. Anyway, enough for me, I think.
Thank you so much, Professor Michael. Really enjoy your conversation. I want to ask a question. Actually, Dr. Nekoofar mentioned the most important soft skill that he thinks is critical for the students in his lecture. As he talked, he mentioned that critical thinking is the most important soft skill that he thinks is important for us. I want to ask Professor Sompop and also Professor Michael that what do you think? What do you think that is most important for us as dental students, as undergraduate students?
So I'm gonna let Michael go first because he's more senior.
No, yes, that old. I love that. How polite you are. Thank you. I think what Dr. Nekoofar, critical thinking is crucial. But much as I love him dearly as my friend, I'm going to say there is something more important to me than this. If you're going into healthcare, the first thing you need is compassion. You need compassion for humanity, for human beings. The patients are not just the ticket to your next salary and your next fast car or your next house. It's about compassion and caring. So that's my answer. Compassion is the first word I put up there.
Thank you so much. What about you, Professor Sompop?
I agree with Professor Michael, actually, because I think the compassion is one of the most important. But I think I look at it more globally, not just compassion, but professionalism and ethical. And I was want to touch on when Michael talked about, can we teach the people to be more ethical? And I would agree with him, because when I was at High Point University, we used CASPER exam. Was a CASPER exam with a test for not for knowledge, but for soft skill, meaning that how to work as a team, ethical situation that they face, and professionalism. And I think part of being a healthcare provider, you have to be compassionate, you have to be ethical, and you have to have integrity. And these are part that I think part of soft skill, and I'm not sure that we can teach them. I think that certain people, we probably can teach 80% of the population, but I'm sure that 10-20% of the people probably should not be in healthcare profession, because certain ethical behavior we cannot train them, and that's part of admission process, right? We have to make sure that we screen out, in not just the people from technical skill and knowledge, but also the ethical behavior that they can display.
Thank you so much, dear Professor. So I have a question that, and also I think Dr. Puyan asked in the chat box that how can we access the students for the critical thinking and also compassion?
When I was at High Point University, we actually have part of their, so we have integrated curriculum, meaning that they don't get assessed by subject. They get assessed holistically, meaning that we put exam together so they get assessed at every module, meaning every 8 weeks or so they have exam. And the exam are combined with all the things that they learn in the last 6 weeks or so, and also including the case base. So meaning that I will give the technical part of the Prof. The behavioral science faculty would talk about the patient's psychological profile and how to deal with the patient. And then the basic science faculty would talk about, like a systemic health and all neurology problem with the patient. So we have one of the things that I think that a lot of dental schools should think about is instead of doing subject-based exam, you want to do holistic-based exam and also talk about how to deal with the patient. And actually, we included that we have an actor patient, and the patient will come and tell them whatever thing that related to that 6 weeks that they do, and the student's supposed to interact with the patient and record it. And we have the faculty independently grade the student, and not just grade the student on just the didactic skill, but also compassion. If the student have an open communication with the patient, have active listening, and also if the student work well with the team.
Thank you so much, your doctor. Dr. Nekoofar, I want to ask your opinion about this question.
Actually, I think Professor Sompop clearly covered this part about the critical thinking. The best thing is case-based discussion. I think case-based discussion is the key factor for critical thinking. And also the way for the examination, the OSCE is the best way for the examination to actually improve this type of critical thinking. In addition to that, I would like to add about the journal clubs in which we can teach the students how to critically appraise the articles, because some of the articles or some of the manuscripts, they just publish for the sake of publication, not they just publish for increase of our knowledge. And we need to be able and have enough tools to actually critically appraise them as well. So if I put them together, case-based discussion in each clinic is very, very important. OSCE examination, even if because in our system, we don't have integrated yet, like you mentioned, but we have some sort of mixed integration in the last 2 years. So if we make it OSCE is really very good, but the idea of role playing as a patient is also very good. We need to try that. We need to add it up to we don't have such a things yet. Because sometimes this approach by the gamification like that, so have a role player or something, is a very good idea. But sometimes we want actually to be very posh, as I mentioned, this is the prestigious things that professors don't like actually to mix up to gamification or such a things. Yeah, that's my idea.
Thank you so much, dear professor. That was really helpful opinions. I think our
Professor Sompop wants to add something.
Yes, of course.
Oh, I was going to add that I think the other thing that we're doing that differently than other dental schools, that I have a lot of reflection, and I put it in my presentation. So in all of the didactic, in all of the lab exercise, in all of the patient encounter, our students are supposed to write a small part of reflection. And I usually prompt the question, what are things that go well, and what are things that go really badly, and what are things that they wish that they have knowledge or something that they could do better. So these are 3 things that they reflected every single time they go into the lectures. And I think part of it, lecture or lab or patient care, and part of it is we talk about, I think Mohammadhossein talk about self-aware, and our students are not trained to self-aware because we don't give them time to reflect. So they need time to reflect, and they need to write down their reflection, and they need to talk about reflection with their faculty.
Thank you so much, dear professor. I think our participants have some questions. Reyhane, I will give you an access to unmute yourself and ask your question from our professors.
Thank you, Nursajan. I want to thank you all for all of your amazing lectures. I actually have like 2-part questions, but my main question is for Dr. Bencharit, because I need to introduce myself first. As in November, I will be in 5th year dentistry student at University of Belgrade, and since my 2nd year, I've been doing stem cell research. And with regenerative dentistry, a little bit of biomarkers, a little bit of stem cells of oral carcinoma. And I want to ask you about soft skills that a scientist in this section might have. Because when people hear the name of stem cells, it's big ethics. Everyone wants to pop out. Everyone wants to have opinions on it. Especially even our own colleagues, like when they want to work on prosthodontics, endodontics, and stuff like that. But when you go to stem cells, they are not in a positive way about it. Like I've been to some congresses and I had to justify that more than what we have done with the cultivation and everything. This was my first question, as in stem cells and ethics, that we can have both in future, that we are going to use this science, and the skills that we can have for our own colleagues to come and listen to this rather than the whole mechanics and the materials that they are used to. Thank you.
It's a wonderful question, and I'm telling you that I'm a clinician scientist, right? I have a PhD. I was doing PhD. Actually, my PhD work was in protein crystallography, which is the structural biology, and I was the only dentist who doing this work at the time. And what happened was, when I'm in the chemistry department, nobody ever asked me any question about science because they just think I'm a dentist. So they all come to me, and I always get excited when people come talk to me. I thought they're gonna talk to me about my research. No, they ask about dental questions. So like, oh, I have my tooth hurt, my wisdom teeth hurt, when should I do that?
Exactly.
And none of them ever talk to me about science. But what I'm telling you is, it actually, you are doing an interesting research field, and it also somewhat controversial, because especially in the United States, some people don't accept stem cell, especially embryonic stem cell could be challenged. what I try to tell you, you have to develop what we call the communication skill, meaning that you have to be aware. Of course, you're aware that people don't care about your research. How would you make people care about your research, right? And you have to communicate that you have to be where your listener are, meaning that usually because we're such a specialized scientist, it's hard for us to go down to the level that we can talk to everyone. So you have to know your audience, have a good communication skill with whoever you want to talk to about your research. But it's important that, especially if you're gonna grow up to be a researcher, that you are able to sell your research, meaning that you have to learn the soft skill, meaning that not just talk about your research in the most common term, but to make people realize what potential that your research could be, and how many people you can heal, how many diseases you can heal from your research. And I forgot what your second part of your question.
I just saved the second part. I had this experience at the like a Mother United Nation, and I was like in WHO, and I was like representing China, which was like a little bit like commenting on the whole situation, and the subject was AI. So it was like everyone was against me and everything. But what I was pushing forward, again, my question is for you, was biomarkers and AI in biomarkers, and I didn't spend a lot of time trying to like debate the whole everything that we can do, but more teaching what is biomarkers and what can we do if we ever get to use AI in here. Again, I found it like a little bit frustrating because we were in this room of people who were from different major of political science, and they had like no idea like what even biomarkers were, but they were trying to regulate it. So what I'm trying to say is, as someone who knows this kind of, I mean, as a student who knows this kind of stuff, how do you recommend to like trying not to teach them everything because there's not enough time to teach everyone, but to bring them in a line to not to be wanting to uh, listen to someone who's the professional? Because when they're like, okay, we have the power, we can regulate you, but we also don't know what it is, but we are going to regulate you. So it was like very like a big thing for me that happened in that experience.
It's difficult because like especially the world is so divided.
Yeah.
Michael and I live in a country that's very divided. I told my wife all the time, I'm more like independent, somewhat democratic person. My wife is a very, very far left person, and my son is libertarian. Which, if you know United States, we should be sitting and have dinner together because we fight all the time. But what I'm saying is we need to get a buy-in from the other side, meaning that they're not going to know what you're talking about. They're not going to understand what you're talking about, but of course they're afraid. It's the same as a patient, right? When you talk to patient, if they don't understand what implant is, they don't understand what root canal is, they don't understand what take out wisdom teeth is. You have to educate them, and you have to get the buy-in. For registrator perspective, you need to get an ally. And you don't have to have everybody to understand you, but you just need to get one or two people to be on your side. And you have to learn how to talk to people who doesn't agree with you or anything. Like my son would not agree on anything about me if I talk about to him in politics. I just have to find a common ground, and we have to work on what we have in common.
Thank you. Thank you. Yeah, I understand. I ended up like writing a coalition on like some collaboration. It didn't pass, obviously, because I was the Republican of China. But I ended up like getting like acknowledgement and some kind of what was it? I was like, oh no, this is not important to me. As long as you guys live and know what biomarkers was, that's enough for me. That's everything that I did. So I thank you again for your presentation, and I'm really honored to actually be able to talk to you. And also Dr. Nekoofar, who's my professor, Dr. Yakovlevich from University of Belgrade, is very fond of you. And he even asked me about if there's going something to happen between universities that I would be invited, like be involved somehow. And I was like, okay, maybe I can like write some sort of proposal between our faculties. So thank you again.
Thank you.
Thank you so much, Professor Sompop, and also Rehane for your brilliant questions. Before we continue, I want to say hello to one of our dear professors, Dr. Mohammad Khami, head of Department of Community of Oral Health. Dr. Khami, I think you have the access to unmute yourself, and if you have any comments, we will be glad if you share it with us.
Okay, hello. Can you hear me?
Yes.
Okay, thank you very much. I would like to say hello to all of the participants in this fruitful discussion. And I say hello to Michael, my old friend, Professor Nekoofar, my mentor, and Professor Sompop. I'm really happy to know you and to see you here, to meet you here. Okay, I'm really enjoying the discussions. I think many things now are discussed that are fruitful and beneficial to the dental students. The soft skills are very important, and I think during the discussions there are some points that can be come to consideration of the dental students when they are working, when they are tackling with the patient's problems, when they are even with the last question when they are working even in the labs. Yes, I'm enjoying, and if I have any comments, I will tell you. Thank you very much.
Thank you so much. Okay, I think Mohammad Reza have a question. Mohammad Reza, you can unmute yourself and ask.
Can you hear me?
Yes.
I wanted to ask a question from Professor Sompop, if it's possible.
Sure.
Is it okay? All right. First of all, I think your presentation was very intriguing. Something caught my mind as someone who just presented about soft skills and my experience in a competition. I wanted to know how measurable, how quantifiable are they? To my understanding, you said having a holistic method is better suited to measure these kind of skills. And my follow-up question to this that I just said is, how can an AI model that I think you mentioned in your presentation use this holistic model and measure these soft skills? Yeah, I'd appreciate it if you answered these questions.
So the AI models that we use is called GAIN, and it only measures. So it records your voice and conversation. We also have another video software that kind of measures something else, meaning that there's a verbal and a non-verbal communication soft skill that you can measure. The verbal communication be how clear you speak and how thorough you speak, and it go through, for example, if you're going to do a treatment plan for, let's say, for an implant, did you go through all of the steps? Did you pause? Did you ask important question? Did you wait for the patient to answer? Did you allow time to the patient to respond? And all those things can be scored and be coded. The nonverbal communication, we can use the video and we look into like, do you have eye contact to the patient? Right, and you have an open posture. How do you position yourself with the patient, and the distance between you and the patient, and all those things can be recorded, and it's not just, this is not just in dentistry. So there are people doing out there for social science have a much more sophisticated tool that can measure both verbal and non-verbal cue, and it gives you response. And the important thing is that the student or the trainee have almost a real-time feedback, right? As soon as you finish your appointment, you have a summary, and it gives you feedback right away, meaning that, Mohammed Reza, you forgot to ask the patient the medical history, for example. And or maybe you have hesitation in your voice, or you don't speak very clearly, or you don't pause for the question, or you don't allow the patient to speak, or you have just yes and no question, you don't have open-ended question. So those are things that can measure over time, and it can help a lot for developing soft skill. Of course, it's not sophisticated enough to to measure the ethical behavior or what you're thinking in your head right now, but you know, eventually it might. But thank you for the question.
You're welcome. Thank you for your response.
Thank you so much, dear professor, and also Mohammad Reza. I have some questions that I have two questions actually that I want to ask. My first question from Dr. Nekoofar. Dear professor, from your experience, which soft skills do you think that are most lacking in new dental educations as you see us in the clinic? What's your opinion about the lacking soft skills?
Oh, okay. So you're talking specifically about our school. Your question is specifically about our school.
No. Actually, maybe, but I'm not sure if you visiting other undergraduates from other universities, but
other universities. Okay, let me tell you actually a story, a real story. When I was in the UK, my mother-in-law visited us, and she suffers from some sort of knee problem. So I booked an appointment in a private hospital in London, and then we went there. And as you know, in our religion, usually men, male and females, we don't shake our hands together. And the professors that I booked the appointment for my mother-in-law came out from his office and just start shaking the hand of my, actually bring his hand to my mother-in-law to shake her hand. And my mother-in-law was like that, she afraid. And then I explained for the professor that we don't touch each other like that. So the professor was very ashamed, and she said, "Oh, sorry, I should have known that. I shouldn't do that. So can I carry the bag of your mother-in-law inside the office?" And my mother-in-law said, "No, my money is inside it. I don't want to give it to you." So it's actually the different cultures create different things, and the soft skills, I think, backs also to the cultural stuff as well. So that is one of the things that we need to improve in ourselves, especially in our university when we are talking about other nationality, other students from other countries when they join us, especially from countries that somehow we think that they are not educated enough. We don't respect them enough. This is one of the things that sometimes I'm very worried about. And I want actually to pass these questions and pass this point to Professor Kowolik and ask him actually to talk about it. And I will come back to that point again. Michael, please.
Thank you.
Well, thank you. I know time is running. You're absolutely right. I came across this so many times. And it's something as simple as a sense of humor. With international students, the number of times I had students, for example, young ladies from the Middle East countries, Saudi Arabia, other countries, your own country, who were offended by something that some professor had said to them. And when I look into it, of course, everything is taken seriously. I look into it, I discover it's just the word you use is culture. And I could probably write a catalogue of examples like that. You're absolutely right about that, and it really is important. Just to say very quickly, next week I'm going back to visit my colleagues in Japan, and that's another entirely different kind of culture where things are handled very differently in very many different ways. And this happens all over the world, and we shouldn't be surprised. And you're absolutely right, Mohammed. I had to educate a former very senior colleague before I took him to the Middle East to explain just that you don't do things with your left hand, that you don't shake hands, you don't even offer to shake hands with a lady under any circumstances, unless it's profit. So you're completely right. Since I've got a moment, and I don't know if there's going to be time, I would like to just ask Mohammad Reza, first of all, congratulate him on his prestigious scholarship, but also maybe a question he doesn't want to answer in front of this audience with this group, what he learned that he would bring to change the culture of his own dental school? And with all your professors there, Mohammed Reza, I understand you may not want to answer that question here, but I just it would be intrigued to know more about this program you went through, because it sounds fascinating.
All right, can you hear me?
Yes.
Yes.
Yes. Thank you, dear Professor Kowolik.
Yeah, great words. I think in our dental school, there are a lot of gaps, and students should try more, should do more for these kinds of competitions. I think the most important reason that students like me, undergrad students in Tehran University of Medical Sciences, do not enter these kind of competitions that not only measure your hard skills, but also take your soft skills in account, is they don't know about them. Maybe educating them that these contests happen, these are available, you can enter them, will help them to grow their soft skills more. And I think by resolving this issue, the major part of it is gone. I think it will be all right if we do that. And maybe there are other things that I should maybe think more and then talk about them. But I think this is enough for this question.
Mohammed, the question is, what do you like actually to change in our school, in the atmosphere that we are in? And what do you like, for example, me to change myself, to create a good atmosphere for you actually, as a student, as an example?
Mm-hmm.
So
That's
that
a
is the
tough
question.
question.
Don't worry about that. You can talk. While Mohammed is thinking about that, Michael, I say that I think we need to teach our students how to give a lecture, because giving a lecture, not scientific lecture, but giving a lecture, that means we give them this soft skill to communicate, to transfer what they think to others. For myself, actually, I graduated from a high school that was some sort of let's say, elite people or something like that. And then in our school, when I was actually in primary school, they asked us to give lecture. And the lecture was like a random lecture. I was like 12 years old, and it was a box with random titles inside it. So we just remove it and talk for 3 minutes about that. And they also ask other students to create some sort of noise, some challenge, and ask us to manage this challenge. For example, somebody started yawning in front of us. So there was actually a box for challenge, a box for the lectures. So we pick up a lecture randomly, they pick up a challenge randomly as well. So they created some sort of challenge for us and ask us as a lecturer, as a kid, to manage this type of actually challenge. So that type of soft skill, still, I think there is a big lack for such a things in our students, in our school, and even in our professors, even in our some of our staff. Still, they can actually transfer their knowledge, they can transfer the technical knowledge to others, but not actually something that you want actually to tell others, to criticize others in a polite way, how to do that, how to do such a things in a lecture. That is one of the things I believe there is a lack in that for our students. But I think Mamarza now got time to think about that. And then now, what do you think, Mamarza? What do you want to change in the School of Dentistry of Tehran University?
All right. Probably educating.
Look at his face. Look at his face. Now he's ashamed. That is what am I talking about.
All right. Probably educate the professors that soft skills exist and they should know them. I think that is a critical step, and probably I don't know, holding competitions in our school that focus on soft skills. That may also help, because I think they're lacking. In my 2 years of majoring in dentistry in this university, I haven't seen one competition that focused on soft skills or even taken them into consideration. You know, it's all hard skill, knowledge, technical knowledge, academic knowledge. But
So
yeah.
let's say you're talking about the extracurricular activity to improve the soft skills for every student. Puyan, that is your job to do that. Because now
Sure,
I'm not in the school, I'm
absolutely.
in the research
Sure,
center. Mike.
absolutely. Thank you, Mohammad Reza, for your suggestion.
You're welcome. I hope I live.
Thank you so much. Okay, as we don't have, as we have just 15 minutes, I want to finish our discussion panel with two questions from all you professors. First question is, why is leadership an important soft skill for the dental students? Why do you think that leadership is important? I think we can start with Professor Michael.
Thank you very much. I think that was already said by one of the speakers. I think since most dentists go into practice, whether it's specialist practice or general practice, they are going to be the leader of a group, of a team. And sometimes the teams are 2 or 3 or 4 people, and sometimes they are 24 people. And I know people, colleagues who have been in both categories. And a lot of the success of the practice, and not just financial success, I mean, depends on that. But you see, there are different, this is another whole thing. Leadership skills are many and varied, and there are hundreds and hundreds of books written about leadership. And what that tells me is nobody really knows the answer, because it's inside you. What the kind of person you are, the character you are. It's like ethics. To be a leader, it's inside. Some people are authoritarian. Some people, like I think myself was, what they call servant leadership, which is about teamwork, which is about including people, and that works well. But it doesn't work for everybody. But I think that's where, understanding the soft skills are important. Understanding the individual, what kind of person you're dealing with, whether it's faculty, a senior professor, a dental student, doesn't matter. Everybody is a leader, and it doesn't matter. You could be the chief of a massive multinational oil company. Everybody needs leadership skills where they have responsibility for other people. I don't know if that's a good answer for your question, but I feel very strongly about that, because I don't think you can be a leader just by reading a book.
Thank you so much. I want to ask Professor Sompop about this question.
Thank you for, I think Michael already picked everything out of the question already. But to me, I think that the part of the dental school training, majority of our training are focusing on individual success and individual development. And the leadership skill are more like how did you get things done as a team or as an organization? And we usually forget that, we never work alone. I cannot see patient by myself, because I would need my front desk, I would need my dental assistant, I might need my lab tech, and I would need all kinds of people to help me do things. So then leadership to me, meaning that ability to get people, for example, like, we just have a question about how can we talk about biomarker and AI and stem cell for the people who don't understand any of these. And part of it would be like work as a team. How can you get your team to work with you? And what is your leadership style? And how did you have self-aware enough that you develop yourself and change the thing? And also you have to understand culture. So obviously, if it were my dental student, even before they come into dental school, if I ask them what they want to improve in dental school, they would talk for hours. They will have opinion for hours versus Mohammad Reza is one of the best dental students you have here, and he tried to talk about things, right? So this is, for example, is the cultural differences that you have to get through the barrier as a leader or as a dental student. And I think those are probably would be my answer beyond what Michael already said. Thank you.
Thank you, dear professor. I want to ask Dr. Nekoofar. if he wants to add any comments to the
Yes.
previous
Again, I
talks.
think it's back to cultural things. I think the way that our dear guest answered to that question is a bit more cultural. In our culture, I would say the leader must be able to inspire others, to have some effect or guide others to achieving a common goal. That is very important in our culture. So the people that they think and they are expecting from their leader in their school, in the department, everywhere, they are expecting that leader knows the goal very well, even they don't know the way how to achieve that goal. They are expecting the leader to know exactly what is the goal and how we can achieve to that. That is the first. So the leader is the one who has this ability to show this ability to others or have some influence to others, I would say. So therefore, a leader should have a vision. So we should actually try to improve the vision of our students. If we improve the vision of our students, and the way of the decision making is also very important for them. So in our situation, I don't want actually to go to details of our situation. I would say crisis handling. We have a lot of problems, a lot of challenge, a lot of challenge, everyday challenge. So we get used to that. Sometimes I make a joke and say that all of my bodies and my organs all of them are ready for any type of crisis because I'm completely keratinized, as Puyan said. All part of my body keratinized. I'm ready for everything. So this crisis handling is a part of the skills and soft skills of a leader. You know, today morning, some of my colleagues in research center asked me, what should we do about the lack of this, lack of that? I think, don't think about it. Just leave it to me. And I was sure that I cannot handle that. But I just transferred that problem to myself just to make them relax. And they said, what happened tomorrow after the decision of the UN about the sanction, about a lot of things, snapbacks, stuff like that? Everybody asking me about the snapbacks inside the taxi, inside the room, everywhere. But I say, I don't mind, I don't care. What is a snapback? And they say, oh, you don't know a snapback? I say, no, but I just ignore it, leave it to me. I am the head of the institute, I can manage that. But I know I cannot. I just transfer their problems to myself. So let's talking about these skills for our students in terms of the patient care during a crisis handling. So you can imagine they become leader immediately if they want actually to handle everything like that. So it is possible, but staying calm under pressure and making quick decisions, this is one of the skills that we need to improve in our students. So we can play, we can arrange some sort of game for them, some role playing, a patient shouting at them and doing something like that to improve their skills in crisis handling, I think. And at the end, innovation. Innovation, I think, the key for reducing the stress and thinking. So if you have an innovative thinking, when something like that happens, as a leader, you have some other alternating way to solve the problems. So let me advertise myself a little. So finding the orifice of a calcified canal is a big challenge for me as an endodontist. So when I have a pulp chamber, highly calcified, I open it up, I cut an access cavity, I couldn't find the orifice of the canal. This is the big challenge for me. So I use innovation and I use innovative way to solve this problem by actually developing a device to find the orifice of the calcified canal. I'm very happy about that. And every time when I use my device for that purpose, I said that, okay, that is the best things happen in my life. So that means by using an innovation, I create some sort of cushion for myself to have some rest during this crisis handling situation. Sorry about that, because the way that I want to talk about the leadership absolutely may be different culturally from others. But that is the way I think that we can communicate with our students easier. Thank you. Michael, do you want to add something to mine?
No, I think you're absolutely right, but it becomes a much more complicated, a much bigger topic to discuss in this. But you're absolutely right. I think innovation, original thinking, not many people have that skill, actually, in my humble opinion. But to some extent, I think that can be taught. I just want to come back very quickly to something Dr. Sompop said. I completely agree about the team, what he said. What brought to mind was years ago when I used to have a private practice and running the clinic in the university in England. And when somebody one day said to me something like, yes, but she's only your dental nurse. I didn't very often get angry, but I got angry that time. I said, don't ever say she's only my dental nurse. She's doing something that I cannot do, first of all. And secondly, she's doing something which is absolutely essential to the success of what I'm trying to do. So sorry, I just had to get that off my chest because you're absolutely right. Mohammed, I don't have a clever answer for your to respond. I think you've touched on so many important things that are very relevant to life as well as running a successful university or clinic. And I love your idea about making people feel less stressed. And that includes, also includes delegation. Because when you delegate responsibility to people, you give them a challenge and that helps them grow. And I have to say that in my professional life all the way through, even my personal life, when that's happened to me, I've looked back on it and seen it as something very positive. This is another whole conversation.
Yeah, I have a comment actually from Professor Nekoofar before we go to Muhammad Reza, that actually when you talk about doing role play, and we do a lot of role play in High Point, and we do a lot of flipped classroom, meaning that our dental student teaching themselves. And I think that that go with role play even patient, because talk about cultural differences and talk about different leadership role. I think that we should be treating people like the way they want to be treated, not the way we want to be treated. So, and in our dental school, for example, the dental student will rotate to be front desk. They're going to be dental assistant. They be dental hygienist before they even do a practitioner. So they understand everything about the practice, because part of being a good leader is being able to understand how your organization function. If you don't understand how your lowest staff member work, then it's no way for you're going to be able to do anything. So that go with the empathy, you learn how to be a patient, and you learn how to be a staff member. And I think that part of the leadership skills. So flipping classroom, have them teach each other, is a good one. All right, I'm going to pass it on to Mohammad Reza.
Thank you. I just had a short comment. My professor, Dr. Nekoofar, said all the things that I wanted to say, but I wanted to add something. Participating in this competition showed me how essential soft skills are, but not everyone in our university will experience it. Maybe showing dental students how important they are and how can they affect their lives, maybe in a series of lectures by key figures in our university like you. Maybe it will improve the situation. I think this is one of the greatest steps that you can take to resolve this issue. And thank you for your kind words.
Thank you, Mohammad Reza. As our last question, I want to read Sina's comment, and then I think we can finish our session. Sina asks, dear professors, where do you think is the best place for us, eager undergraduate students, to start and initiate our international networking and soft skills development? Feel free if you want to answer to Sina's question.
So I think that one of the things that you could, obviously we have international people right now, right? So and of course there's a barrier between, now we have tariff and nobody want to come to United States because, people love our president so much that But anyway, so I think that number one is be involved with international organization. So depending on your specialty interest, you can, if you're interested in research, the IADR is a good one to get involved. The education side in the United States and Canada, we have American Dental Education Association. European one have the AD, which is kind of similar. So I think that involved with international organization, and then get involved with the student organization. And the student organization, the ADA have one here, and the IADR has one. And I think the student organization in those organizations are very active. And that probably would be one of the way to get involved. But I don't know. So far, I don't know any soft skill specific organization that we have in dentistry. Maybe we can start one.
Yeah. And
Yes, thank you
I
so
would
much.
just add about the international part. You have great professors there who all have many have huge international experience. I know this personally. Dr. Nekoofar, Dr. Poyan, Dr. Hami, in different parts of Europe, different parts of the world, and we've even met. Not only my pleasure to be in Iran, but also I probably shouldn't say this publicly, but I circumvented the United States regulations a few years ago. And I met some of my wonderful colleagues here in Germany, because I can get to Germany and they can get to Germany, and so we met in a place in Berlin. And so there are ways to do these things, and I'm also scheming things in Japan at the moment. But but you're absolutely right, Dr. Sompop. There are organizations, but I would start with your professors here who have great connection around the world if you have an interest. And of course, if you have a specific interest in some area, whether it's soft skills, education, endodontics, pathology, whatever, I think it's a good place to start.
I just want to add some small things. First of all, about the International Association of Dental Students, IADS. I think some of you already members of that, and that is also very cheap. So you can actually afford such a things. Membership in IADS can be very helpful. That was the first international organization that I was a member of that. And then after that, I become a member of the Young Dentists Worldwide. After IADS, when you become a dentist, you can be a member of the Young Dentists Worldwide. I'm still young, by the way, but I can actually, I'm not able to be a member of those group at the moment, unfortunately, because of my age, but you can. That is one thing. And about the soft skill, actually, when I prepared my lecture for today, when Puyan told me around 10 days ago about preparing something for that, I started actually searching, and I find actually two very, very good and impressive courses in Coursera. So if you go to the platform of Coursera or even FutureLearn or some FutureLearn actually in Iran, because it actually becomes from the UK, you need actually some sort of, there are some restrictions for that. But for Coursera, you can go there and they are free. Free courses for improving your soft skills in Coursera can be helpful for that purpose. For internationalization, as our friend Professor Michael said, that as you can see in this, just in this picture, you can see two ex-vice dean for internationalization of our school, which is Professor Khami and myself, and also our vice dean, Professor Shakib. That actually, Puyan is very, very active, and we are very happy to have him back to the office. So yes, the international office, with all the limitations and with all the problems that we have for the communication with some countries, we still are very, very active. And this type of communication, as we said, the web-based communication, and these are also very good in terms of improving your international communication as well as your soft skills.
Thank you so much, dear all professors. I think Reyhana have a question, but Reyhana, I'm so sorry because I have a lot of time, and I think time management is one of the soft skills that I learned from our dear professors. I just want you to accept my apology, and I want you to send our professors, I think they mentioned their emails and also some social medias that they have. You can ask your question from them via that links, and I will be so grateful. Thank you so much. Thank you so much, all
Can I
dear
add
professors.
something?
Yes.
Professor Kowolik, Professor Nekoofar, Professor Bencharit, thank you very much for sharing your knowledge and experience with us generously. It's very kind of you to join this program, and I'm very honored of my student Dorsa and Mohammad Reza for moderating this program. We tried to make bridge between universities, countries in this era. Professor Nekoofar well explained. We are trying to provide peaceful scientific network and bridge between universities instead of other things. You well know about that. Thank you again for being with us. And the platform is again for yours, Dorsa.
Thank you so much. Yes. Before I start to say goodbye to all of you, I want to ask everyone to open your cameras, and we can take a photo as a memory, I think.
I think while we are waiting, you may ask, you have some exemption and ask Rayhana to have her comments quickly.
Okay. That's okay. Okay. Rayhana, I think you have the permission to ask your question. Okay, I will unmute you now. Can you please raise your hand?
Can you hear me now?
Yes.
I just wanted to ask a very fast question, since you mentioned like international congresses. So far, everything I've been like across Europe, we're like in a student level. And as a student, like my next plan is to go to ISCCR for stem cells, and that's like next year. And honestly, I feel like it's too soon. And it's like I would be like, I don't know, too small for such big events of stem cell biology with postdocs and scientists. So the thing is, maybe it's other students' question, like when someone is eligible for such meetings with someone like peers of that big events. That was like my main question. So thank you.
Professor Sompop, you should answer.
Oh, I shouldn't be answered that anymore. So I think that this day and age, there's more connection than just going to the meeting. I think that you might want to. The social media had changed things so much, and I started to be more active in LinkedIn probably about a year and a half, and now I have like 5,000 some people follow me. So I think that would be one of the venue that you could think of, other than, when you go to, you can only go to so many meetings. And right now, because the travel restriction, is hard to get together. So the webinar is a great tool to get together. The social media, the LinkedIn has been wonderful. And there are also courses on LinkedIn that you can develop soft skill, or you can leadership skill, or networking. So those probably will be something that you can think about.
So I'm an old-fashioned guy. I can't argue with anything Dr. Sompop has said. He's absolutely right. In fact, COVID did us a huge favor globally, right, with regard to opening up this kind of communication. But I'm also old-fashioned, and I think the most important conversations ever happen face-to-face. The way I put it is breathing the same air as somebody. I learned that with difficult conversations sometimes with people when I was at university. But when you go to a conference, if you choose your conference carefully, obviously money's involved, time's involved, even politics could be involved, those restrictions. But if you choose your conference carefully and you go where you know the people are, and your comment about being too young or too junior, it's irrelevant. You will learn something. You will learn something from going there. And, you might be a little bit timid about speaking to some superhero professor that's globally famous for the content. But if you go with an open mind and prepare to learn, and of course communicate and say what you think, I think you can go when you're 15 years old. Doesn't matter.
Perfect. Perfect.
Great, great.
Thank you so much, dear all professors. I think we can now take our photo and finish our session. And I'm so grateful for your time and for your interesting things that you actually share with us. As an undergraduate student, I personally really enjoyed the meeting. And thank you all participants for joining us today. I know we have, a difference in time. Some of our panelists were from the US, and thank you so much for accepting our invitation. Now I think we can, if everybody are
Yes.
ready, we can smile
Wrap.
and 1, 2, 3.
Thank
Thank
Thank you.
you
Dorsa,
so much.
can I say
Thank
something
you.
quickly?
Thank you.
I'm
Yes,
so
yes,
sorry.
of course, Professor.
Yeah, I'm truly and deeply honored to be in this meeting and being able to speak as an undergrad student with professors like you being present. It was an experience for me. Thank you. I appreciate it.
Thank you.
Thank
Thank you so
you.
much.
Very nice. Have a
Bye.
good
Have a
day.
good night.
Bye bye.
Bye-bye.
Have a good
Bye
day
bye.
and bye.
Thank you.
Bye bye.
Thank you very much, Professor Sompop, Michael, always. Thank you very much indeed.
Bye-bye. Lovely to see you all.
Bye bye.